Hello everyone, this is Pathak and you're watching my channel. So today I will talk about chronic kidney disease, and this is a very important topic and a very new topic as well. And please don't forget to like and subscribe my channel. Also please do not forget to follow my Instagram account, which is healthcare for you forever. So let's get started with this particular presentation. Okay, so what is chronic kidney disease? So chronic renal disease, generally referred to as chronic kidney disease, is a disease in which kidney function gradually weakens over time. So kidney function is weakened over a time, okay, and the kidney starts losing its function because there's an overload on the kidney. Okay, so kidney is basically filtering the blood again and again, and that filtration of the blood repetitively has caused kidney to lose its function. Okay, now let's talk about the causes of chronic kidney disease. So causes of chronic kidney disease. So first one is the diabetes. So diabetes occurs when your blood sugar remains too high. Over time, unmanaged blood sugar can cause damage to many organs in your body, including the kidneys and heart and blood vessels, nerves, and the eyes. Okay. So basically, in diabetes, the blood sugar level is really very high. Okay. When there is a lot of blood sugar, what happens is that the viscosity of the blood is very very high. Okay, the blood is not fluid at that point of time. So what happens is the nourishment is not there. The proper nourishment to nerves and the eyes and the heart and the kidney is not there. There's no proper circulation of the blood due to the high viscosity of the blood. Okay, the blood is highly viscous. So what happens is when there's no proper circulation of the blood, so obviously all the organs are not getting proper nourishment, and also there's an overload to the kidneys. The kidneys are filtering the blood again and again, again and again, and then they are not able to filter out the waste material properly because there is a increase in the levels of blood sugar. So there's an overload on the kidneys. When there's an overload on the kidney starts losing its function. So that's when the chronic kidney disease starts occurring. Okay, so this is the main cause of the chronic kidney disease. Now, talking about the high blood pressure occurs when your blood pressure against the walls of your blood vessels increases. If uncontrolled or poorly controlled, the high blood pressure can be leading cause of heart attacks, strokes, chronic kidney disease. Also, chronic kidney disease can cause high blood pressure. So, high blood pressure and the chronic kidney disease both are interrelated to each other. Okay, so whenever it is not controlled properly, so it can lead to chronic kidney disease. Okay, that means there's no proper flow of blood and there's a lot of pressure on the blood vessels. So this uh, can lead to harmful effects on the kidney. Okay, now let's move on to the next causes of chronic kidney disease. So the next cause of the chronic kidney disease is glomerulonephritis. So glomerulonephritis is a group of diseases that causes inflammation, damage the kidney filtering units. These disorders are the third most common type of kidney disease. So kidneys filtering units are known as nephrons, and these nephrons are basically present in numerous amounts in the kidney itself. Every nephron has a Bowman's capsule, and in that Bowman's capsule, there's glomerulus. This glomerulus is basically really very important in the filtration of the, you know, blood. But if it gets inflamed, the kidney is not able to filter the blood properly. So it leads to chronic kidney disease. Okay, so this is one of the causes of chronic kidney disease. Now, next comes the inherited diseases. Polycystic kidney disease is a common inherited disease that causes large cysts to form in the kidneys and damage the surrounding tissue. So, cysts can, damage the organs. So, whether it is uterus or kidneys, it damages the organs and it also makes the organ to lose its function. So whenever there are so many cysts, it basically hampers the functioning of that organ. So again, here also the cyst is hampering the function of the kidney and it is leading to chronic kidney disease. Now let's move on to the next causes of the chronic kidney disease. kidney and urinary tract abnormalities before birth. So malformations that occur as a body develops in its mother's womb. For example, a narrowing may occur that prevents normal outflow of urine, causes urine to flow back up to the kidney. This causes infections and may damage the kidneys. So basically, what happens is if there's any malformation, if there are so many abnormalities, so what happens is that the kidney is not functioning properly because there's already a genetic disorder or genetic disease. So that's why there's no proper flow of urine, and that is basically leading to chronic kidney disease. Okay, so this is another cause of chronic kidney disease. Now let's move on to the other causes. Now comes the autoimmune diseases. When the body's defense system, the immune system, turns against the body, it's called an autoimmune disease. Lupus nephritis is one such autoimmune disease that results in the inflammation of the small blood vessels that filter waste in your kidney. So this is again an inherent or genetic disease that basically is very very harmful and very dangerous as well. Other causes is obstructions caused by the kidney stones or tumors can cause kidney damage, and a large prostate gland in men or repeated urinary infection can also cause kidney damage. So these were the causes of chronic kidney disease. Okay, now let's move on to symptoms of the chronic kidney disease. Okay, so most people may not have any severe symptoms until the kidney disease is advanced. However, you may notice that you feel more tired or have less energy, have trouble concentrating, have poor appetite, have trouble sleeping, have muscle cramping at night, have swollen feet and ankles, have puffiness around your eyes, have dry skin, itchy skin, need to urinate more often, especially at night. So these are the symptoms of the chronic kidney disease. Okay, now let's move on to the tests of chronic kidney disease. How to detect chronic kidney disease? Albumin to creatinine ratio urine test. So albumin is a protein that shouldn't be found in urine and indicates kidney function problems. Okay, so albumin is a protein. So if there's a lot of protein in the urine, that means your kidney is not functioning properly because kidneys do not filter out proteins. Okay, and so if albumin is coming out in the urine, that means that the kidney is not functioning properly. Okay, so this is one of the tests to detect the chronic kidney disease. And second one is glomerular filtration rate. So the doctor will calculate your glomerular filtration rate. Okay, using the results from the test and other factors like age and gender. The results of the glomerular filtration rate is the best way to measure the level of kidney function and determine your stage of kidney disease. So higher the kidney okay, so higher the glomerular filtration rate, so higher will be the kidney function. So these are the tests to detect the chronic kidney disease. Now let's move on to the stages of the chronic kidney disease. So the first stage is characterized by mild kidney function, though its function may be still normal. The kidney function is about 90%. Here there's only slight kidney damage. Okay. Okay. So, but the function will be still normal. So, it is 90%. Now, stage 2 means mild loss of kidney function has started. Kidney function is about 60 to 80%, 89%. There's then in stage 3A. So, there's mild to moderate loss of kidney function. Kidney function is about 45 to 59%. So, stage 3 is divided into two parts, 3A and 3B. Okay. Now, let's move on to the next slide. Now talking about the stage 3B, there's moderate to severe loss of kidney function. The kidney function is about 30 to 44%. And in stage 4, it is characterized by severe loss of kidney function. Kidney function is about 15 to 29%. And stage 5, it means kidney failure. The kidney function is less than 15%. Okay. So this was like all about the chronic kidney disease. I hope you really like this video. Please don't forget to like, share, subscribe my channel, and also follow my Instagram account. You can also see the QR code on this slide. You can scan this QR code and follow my Instagram account, which is Healthcare for You Forever. Thank you so much. Stay safe and healthy. Bye bye.